back home what we used to do is, this is the posterior triangle now. This is the posterior triangle. Okay, this is the posterior triangle. Here clavicle is cut. The posterior triangle, it is bounded in front by the posterior border of sternocleidomastoid. This is the sternocleidomastoid muscle. Okay, and behind by the anterior border of the trapezius. This is the trapezius. Is it clear? Now, how will you identify the, should I show the muscle? Okay, so that is the anterior and posterior boundary. Base is formed by the clavicle, middle 1/3 of the clavicle. Apex is formed by overlapping of anterior and posterior boundaries. You can see that it is overlapping. Sternocleidomastoid is overlapped by trapezius. Okay. Now, roof is formed by skin, superficial fascia with its contents, then investing layer of the deep cervical fascia. Okay, that is the roof. Now, what are the contents of superficial fascia? We get the platysma muscle, which is removed. Okay, then cutaneous nerves. What are the cutaneous nerves you can see? This is the great auricular nerve. It is going towards the parotid gland just below the auricle. So, great auricular nerve. Okay, this is the lesser occipital nerve. This is the lesser occipital nerve. Okay, lesser occipital, going to the posterior quadrant of the scalp. Then we should have got the transverse cervical nerve and supraclavicular nerve. This is the supraclavicular nerve, but transverse cervical nerve is not there, which should pass across the sternocleidomastoid to the anterior triangle, which is not there. Okay, so this is supraclavicular nerve, lateral, intermediate and medial branch. Medial branch is not there, so there is a supraclavicular nerve. Now you ask me which is accessory, spinal part of the accessory nerve. If you see here, this nerve is coming from the sternocleidomastoid. Say substance of the sternocleidomastoid. If you see that, it is coming from the substance of the sternocleidomastoid and ending by supplying the trapezius. Now another point, another reason why I am telling, the lesser occipital nerve hooks around. It is hooking around the spinal part of the accessory. Can you see that? Lesser occipital nerve, it is coming, curving round the spinal part of the accessory and going up. So there is a lesser occipital nerve. This is the spinal part of the accessory, great auricular nerve, supraclavicular nerve. Supraclavicular nerve. Lateral, intermediate, medial branch is not there, which is cut off. Okay. Okay. Then the floor. The floor is formed by muscles. I am not telling you to identify the muscles because it may not be that important, but you should remember the names to write if it is asked. I identify the probed space or probed triangle, posterior triangle. Name any 3 or 2 muscles forming its floor. So from above downwards, it is formed by splenius capitis, levator scapulae, scalenus posterior, scalenus medius, scalenus anterior, first rib, first digitation of serratus anterior. And these structures are covered by prevertebral fascia or fascia, prevertebral fascia. Okay. Now, what are the contents? The contents of the posterior triangle should lie between the roof and the floor. Between the roof and the floor. Okay, floor. Now, actual content of the posterior triangle is the spinal part of the accessory nerve, lymph vessels, hibernating glands, connective tissue. When I said in the class, I said hibernating glands means pad of fat, which is utilized in some lower animals as a source of energy during reproduction. Okay, so that is the content. Those are the contents. Now, if you read in the book, whatever structures present in the roof or structures present in the floor, they mention as contents of the posterior triangle. In the roof, I said cutaneous nerves and platysma muscle. In the floor, we have got the formation of the brachial plexus. So the trunks of the brachial plexus can be seen between the scalenus medius and scalenus anterior. Between the scalenus medius and scalenus anterior, we have the trunks of the brachial plexus. Okay. Yes. Upper trunk, middle trunk, lower trunk. Can you see that? upper, middle, lower. So they lie one behind the other, like this, one behind the other. Upper, middle, and lower. Upper, pull it. You can see middle, and you can see lower. Upper, middle, lower. Is it clear? Okay. Then still below we have the subclavian artery. Subclavian artery. So those are the structures in relation to the posterior triangle. This is the trapezius muscle, same thing. In relation to this is the masseter muscle, masseter, which I will not ask. There is a parotid gland, there is a parotid duct. Parotid duct. Okay, here. In this, I thought they have dissected suboccipital triangle. No. So this is the trapezius muscle. Trapezius muscle of one side, opposite side. Okay. Splenius capitis, semispinalis capitis. They have to cut this muscle, then only you can see the suboccipital triangle. Nothing is here. They are not dissected. So this is the sternocleidomastoid. Other muscles. This is the platysma muscle. You can see the platysma muscle. Okay, platysma muscle. Other things are not clean. Sorry for that. This one is the pectoralis major muscle. Pectoralis major. You can see that, right? Pectoralis major. So when you reflect the pectoralis major muscle, yes, pectoralis major muscle, you can see the pectoralis minor muscle. Pectoralis minor. When you reflect the pectoralis minor, you are supposed to see here in relation just below the clavicle, you are supposed to see the subclavius, but clavicle is cut here. So you can see the pectoralis minor. Okay? So pectoralis major, there is a pectoralis major, nipple with areola, pectoralis major. Do you have head and neck specimens, any other specimens?
No, that's just in it.
Okay.
This one.
It is outside? So this is the pectoralis minor, okay, and just go behind. Sorry. Okay, thank you. So this is the pectoralis major. This is the pectoralis minor. Okay. This one is the axillary vein. Axillary vein. Sorry for that. Vein. Okay. It's a continuation of the subclavian vein. It continues as subclavian vein. This is the subclavian vein. So this is axillary vein. This is the brachial vein. Okay. And in relation to the axillary artery, this is the axillary artery. We have the branches coming from the cords of the brachial plexus. This is the musculocutaneous nerve. Okay, this is the median nerve. This is the ulnar nerve. This one is the ulnar nerve. Can you see that? Ulnar nerve. Okay, so this is the front of the arm. Front of the arm. This is the axilla. This is the axilla. If you want to see the boundaries, usually we don't ask. Axilla is bounded in front by the pectoralis major, pectoralis minor, clavipectoral fascia, and subclavius muscle. When you reflect that, you can see the contents. Okay, so axillary vein, axillary artery. This is the musculocutaneous nerve. How do you identify this one as musculocutaneous? When you trace the musculocutaneous nerve, you can see it is passing through and through the coracobrachialis. This is the coracobrachialis. Okay, this is the biceps brachii. Why do you say it is biceps? So this is short head of the biceps. This is the long head of the biceps. Short head of the biceps brachii, long head of the biceps brachii. Okay, and if you trace it down, this is the bicipital tendon of the biceps brachii. This is the bicipital aponeurosis. This is the aponeurosis which is cut off. Okay, which is cut. Bicipital aponeurosis. When you lift the biceps brachii, you can see the brachialis. Passing between the brachialis and biceps brachii is the musculocutaneous nerve. And it gives branches to biceps brachii as well as brachialis, both the muscles. okay, and continues as lateral cutaneous nerve of the forearm. And this pectoralis minor divides the axillary artery into first part. There is a first part of the axillary artery, behind it's the second part, below is the third part. Below the pectoralis minor is the third part, behind is the second part, above is the first part. First part gives superior thoracic artery, second part gives lateral thoracic and thoracoacromial trunk, third part gives subscapular artery, anterior circumflex humeral, posterior circumflex humeral artery. Okay, branches are not at all traced. Okay, so that is about the contents here. So axillary artery I showed, the musculocutaneous nerve I showed, the median nerve I showed, the ulnar nerve I showed, okay, and pectoralis minor. This one is medial pectoral nerve. Anyway, I may not ask that. And this is the pectoralis major, pectoralis major. Okay, these things are clear, right? These things are clear. Okay. Then you can see behind. This one is the trapezius. Okay, reflect the trapezius. Deep to the trapezius, you can see this is the medial border of the scapula. Medial border of the scapula. Okay, attached from the superior angle to the triangular region in the root of the spine of the scapula. This is levator scapulae. This one is rhomboidus minor. This one is rhomboidus major. Levator scapulae, rhomboidus minor, rhomboidus major. This is the supraspinatus muscle, supraspinatus. Infraspinatus, teres major. Okay, this one is teres minor. I repeat, supraspinatus, infraspinatus, teres minor, teres major. Okay, and here this one is the latissimus dorsi, which is cut off. Latissimus dorsi. It's clear? So latissimus dorsi, teres major, teres minor, infraspinatus, supraspinatus, levator scapulae, rhomboidus minor, rhomboidus major, trapezius. Okay, it is covered, so it is cut and reflected. Trapezius is derived from post sixth branchial arch, hence supplied by spinal part of the accessory motor and proprioceptive sensation C3, C4 fibers. Okay, levator scapulae, we may not ask nerve to levator scapulae, rhomboidus major and minor, nerve to rhomboidus muscle or C5, and help in retraction, major and minor, and this one will pull the pull the scapula up. And supraspinatus, initial abduction 0 to 15 degree, and it is supplied by suprascapular nerve. Infraspinatus, teres minor, they bring about lateral rotation. Infraspinatus is supplied by suprascapular nerve, and teres minor is supplied by axillary nerve. Nerve to teres minor contains a pseudoganglia in it, pseudoganglia. Teres major, it is supplied by subscapular nerve, upper and lower subscapular nerve, and this one, teres major, brings about medial rotation. Infraspinatus and teres minor bring about lateral rotation, whereas teres major brings about medial rotation. And the latissimus dorsi is supplied by thoracodorsal nerve. Then, so I can touch with this one, but she's okay. So this one is this one. Can you see this? This is the short head of the biceps brachii. This is the long head, and this is the coracobrachialis muscle. And this one is the musculocutaneous nerve. Now, what has happened in this? Can you see this? This is small abnormality, variation. The musculocutaneous nerve, okay, and median nerve, they are getting connected. In other words, this musculocutaneous nerve, from where does it come? Lily loves me, I said. Lateral pectoral nerve, lateral root of the median nerve, musculocutaneous nerve. So lateral root of the median nerve, it is passing via the musculocutaneous nerve, and here it is getting separated and joining the median nerve. Okay, so this is the medial root of the median nerve. There is a lateral root of the median nerve, lateral root, unite to form the median nerve. Then this one is the brachialis muscle. Biceps brachii. See, this is the bicipital aponeurosis which I was talking about. Bicipital aponeurosis. This is the tendon of biceps brachii. This is the brachialis. This is the deltoid muscle. This is the deltoid muscle. Anterior fibers are unipinnate. Intermediate fibers are multipinnate. Posterior fibers are unipinnate. Intermediate fibers are multipinnate because they have to bring about abduction. 15 to 90 degree of abduction is brought out by intermediate fibers of deltoid muscle. Anterior fibers bring about flexion. Posterior fibers bring about extension. Okay, so there is a deltoid. This is the cephalic vein which lies in the deltopectoral groove. This is the pectoralis major, deltopectoral groove, we get the cephalic vein. This is the cephalic vein. And in the lower limb you are going to study, this is cephalic, there you are going to study great saphenous vein, small saphenous. Saphenous means easily seen. In fair people you can see the vein through the skin. Okay, easily seen, saphenous. Then in relation to the posterior compartment or extensor compartment, this one is the long head of the triceps brachii. This is the lateral head. Long head of the triceps brachii. This is the lateral head, and medial head is just beneath. This is the medial head of the triceps brachii. Medial head, long head, lateral head. Between the long head and lateral head, here you can see the radial groove, where you can see the radial nerve. There's a radial nerve and profunda brachii vessels. Can you see the vein here? See that? Okay. Artery is not cleaned. Artery is there. Vein you can see. Profunda brachii vessels, radial nerve. So this is the lower triangular space. This one is the quadrangular space. This is the quadrangular space which is bounded by subscapularis in front, capsular ligament of the shoulder joint, teres minor, and laterally by the surgical neck of the humerus, medially by the long head of the triceps. What does it contain? Can you see the contents here? Can you see the contents? Axillary nerve, posterior circumflex humeral vessels. See that posterior circumflex humeral vessels, vein, and behind that is the artery. This is the axillary nerve. You can see, right? This is the upper triangular space. This is the lower triangular, upper triangular, quadrangular space. Upper triangular space, it is bounded superiorly by the teres minor, inferiorly by the teres major, medially by the long head. It should contain circumflex capillar vessels. Can you see that it is cut? Circumflex capillar vessels. Can you see the opening there?
Yeah.
Of the vessel? Circumflex capillar vessels. That is the upper triangular space. And remaining muscles I think I showed, of these muscles I showed. And subscapularis I think I didn't show. Right. See, when you see the scapula, this is the scapula, right? This is the scapula. I think it is not clear in this. This is the scapula. Okay, that's the scapula. Can you see the muscle here? Can you see the muscle fiber deep to the connective tissue? Yes or no? Can you see the muscle now? That is the subscapularis. In the anterior aspect of the scapula is the subscapularis. Posterior aspect we have the different muscles, supraspinatus, infraspinatus. Okay, so this is the subscapularis. Can you see the muscle? What is there? Okay. 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 I forgot to show about it. Cubital fossa, it is bounded medially by the brachioradialis. Laterally by the medial border of the brachioradialis, medially by the lateral border of pronator teres. This is the pronator teres. So pronator teres medially, laterally brachioradialis. Apex is formed by overlapping of medial and lateral boundaries. Base is formed by imaginary line connecting the medial and lateral epicondyles of the humerus. Roof is formed by skin, superficial fascia, the deep fascia, and bicipital aponeurosis. Okay. Floor, it is formed by brachialis above. This is the brachialis above, and supinator below. This is the supinator muscle below, which you will see in the next class, supinator muscle below. Now what are the contents? It contains median nerve, so that's a median nerve. It contains the radial artery, which is cut off, radial artery, ulnar artery, okay, or termination of, see this is the brachial artery with the two terminal branches, radial and ulnar artery. The ulnar artery, as I told in the class, which is not dissected, gives anterior and posterior ulnar recurrent common interosseous artery. Common interosseous artery, before disappearing from this region, gives anterior and posterior interosseous artery. Posterior interosseous artery, before going to the posterior compartment, gives interosseous recurrent. These branches take part in the anastomosis around the elbow joint. Okay, so that is the clinical significance of the cubital fossa is median cubital vein is used for intravenous injection or blood transfusion. Okay, and it corresponds to the popliteal fossa, which is situated behind the knee joint. So the difference in the location of these two fossae is due to the reverse rotation of limb buds. Upper limb buds rotate laterally, whereas lower limb buds rotate medially. That's why the great toe is medial and thumb is lateral. Okay, and cubital fossa is in front, popliteal fossa is behind. Okay, this one. Can you see the cephalic vein? Sorry, cephalic vein here, cephalic vein, and this is the basilic vein. This one, connecting the two is the median cubital vein. This is the one vein which is used for intravenous injection or drawing the blood. Okay, and this is the thumb, lateral, isn't it? So this is the radial artery, and here down going deep is the ulnar artery, radial artery, ulnar artery, and above is the brachial artery. This is the brachial artery. Okay, that's the brachial artery, radial artery, ulnar artery. Okay, this is the brachioradialis muscle. This is the pronator teres. This is ulnar artery. You can see that ulnar artery, and this is the supraspinatus, and this is the brachialis muscle. This is the supraspinatus. This one here. Then suboccipital triangle. What is occipital triangle? 100% they will ask when you go to the clinic, the clinical significance of the suboccipital triangle. So I am just reflecting the trapezius, splenius capitis, semispinalis capitis. This is splenius capitis. This is semispinalis capitis. Once you remove the semispinalis capitis, you can see the suboccipital triangle. This is the suboccipital triangle, and this one is the suboccipital nerve. That's the suboccipital nerve, and this one is the third part of the vertebral artery. Third part of the vertebral artery, suboccipital nerve. Okay, and this is the great auricular nerve, which comes to the scalp. This is the great auricular nerve. This is the suboccipital nerve, and this is the third part of the vertebral artery. This is obliquus capitis inferior. Okay, obliquus capitis inferior, and this is rectus capitis posterior major, minor is inside. Rectus capitis posterior major, minor is inside. But at least you should remember the region, suboccipital triangle, and you should be able to identify the great auricular nerve, great occipital nerve. Why did I tell this one as great occipital nerve? Because it runs downwards and curves around the lower limit of the inferior obliquus capitis inferior. So if you trace this nerve, it will lead to the lower limit of the suboccipital triangle. So that is the lower limit. Means what? It curves around the obliquus capitis inferior muscle. That's the obliquus capitis inferior. Okay? So that is the third part of the vertebral artery, suboccipital nerve. And if they ask, I can ask, identify the pin space or region, suboccipital triangle, name the structures forming its floor, posterior atlanto-occipital membrane, posterior arch of the atlas, name its contents, suboccipital nerve, suboccipital plexus of veins, and third part of the vertebral artery. Mention its clinical significance, cisternal puncture. Okay, those are the things which you should remember. So that is about the suboccipital triangle. The extrajugular vein. So this is the transverse cervical nerve. Can you see that? So transverse cervical, please see transverse cervical, great auricular, lesser occipital, great auricular, lesser occipital, transverse cervical, and this is the supraclavicular nerve. This is the external jugular vein. So external jugular vein can be asked for the spotters identification, formation, tributaries, termination of the external jugular vein. Okay, that one you should remember. And this is the platysma muscle which has been reflected. See that muscle fibers you can see, platysma muscle. Okay, this is sternocleidomastoid, there is trapezius. This one, this sternocleidomastoid, there is trapezius. Orbicularis oculi, only orbital part is seen, eyelid is removed, palpebral part is removed, only orbital part you can see. This is the masseter, facial artery. This one not missing. This is not over, right? Nasal cavity is not over. Okay, platysma muscle, see that? That's the platysma muscle. See here, this is external jugular vein, but here it is joined by facial vein. External jugular vein is joined by the facial vein. This is the great auricular nerve. Okay? And there is the sternocleidomastoid. This is the portion of the trapezius. Other things are not clear. It's not clean. This is the sternocleidomastoid. In front of sternocleidomastoid is anterior triangle, behind is posterior triangle. And in the anterior triangle, see here, this is the submental triangle. Can you see there? Can you see here? This is important for spotters. This is the anterior belly of digastric. Anterior belly of digastric, between the two anterior bellies of digastric, this is the submental triangle. This is the submental region, this one. Okay? And floor is formed by a muscle called as mylohyoid muscle. This anterior belly of digastric is derived from first arch supplied by mandibular nerve, branch coming from the mandibular nerve. It will go and join the posterior belly, which is not cleaned. Posterior belly of digastric is derived from second arch supplied by facial nerve, branch coming from the facial nerve. So this is the submental triangle, this is the digastric region, this is the muscular triangle, the muscles are not cleaned, this is the carotid triangle. Okay? Yeah, the artery, you can see internal carotid artery, this is all broken, internal carotid artery you can see. Okay? Internal and external and common carotid, they are present in relation to the carotid triangle. So in front of sternocleidomastoid is anterior, behind is posterior triangle.